Good morning, everyone. Welcome to our Parenting Caregiver Corner, where I will be touching upon hot topics and or answering your burning questions. So please don't forget to send any questions that you have. Today we are continuing our conversation about behaviors. More specifically, we are going to talk about biting today. Whether you are a parent, an aunt or uncle, or quite literally anyone who's been around young children at some point in their lives, have seen, heard of, or have been bitten by a child. But why? Why do children bite? Why are we all so familiar with this sort of behavior? I've got 3 great resources that I'm going to share in the description regarding children and biting. But for now, I'll offer you a synopsis of the content. So there are many reasons why kids might bite. For some children, it might be that they are teething and looking for relief. For others, it's a way of exploring their environment. And for some, it's a way of testing cause and effect. What will happen if I bite on this versus that? In addition to these factors, if we take the golden rule that behavior is communication, we might consider the biting to be a result of frustration, anger, fear, stress, overstimulation, or fatigue. This is especially true as we present the fact that in many cases, as communication improves, biting tends to lessen. So ask yourself the following questions after a bite occurred, and then soon you'll be better at anticipating future bites. So number 1, what happened right before the bite? Number 2, who was your child playing with? Number 3, who was bit? Is it the same child every time or a different child? Number 4, what's your child doing? Or what was your child doing at the time? Number 5, where was your child? And number 6, who was caring for your child? This might help you anticipate the bite before it happens because you are considering the environment that surrounded your child at the moment that they needed to or felt like they needed to bite. But what can we do to prevent the bite from happening in the first place? So the first thing you can do is distract the child, shift their attention, and reduce tension. The second thing is to offer a solution to the problem that you anticipate will result in a bite. For example, Marcus, you can tell Anna that you are a little too close to me and I don't like it when you touch my hair. Help your child cope with feeling overwhelmed or stressed and give them those words. Number 3, help with sharing. As we've discussed, this is an emerging ability in the early years, so support children's ability to share, especially when a child has a history of biting. Number 4, read books about biting. Find a way to talk with your child about why we do not bite. And if you head over to our Instagram, you can see 3 book suggestions that will help your children learn why we don't bite our friends. Number 5, finally, as you should with any child, encourage them to use their words. Help your children express their feelings if you feel like they might be struggling to do so on their own. Now, you can't always have both eyes and ears on your children at all times. So what are you supposed to do after your child has bitten someone? First thing you need to do is remain calm to lend your calm. This is true for any unfavorable behavior. If we match a meltdown or a problem with anger and frustration, it's not going to help calm down the child. Number 2, in a firm, matter-of-fact voice, without anger, you should say, "No biting, biting hurts." We want to keep this short, simple, and clear. We do not want to pinch or respond by biting the child to show them how it feels. We do not want to yell and cause further stress. We just want to clarify that biting hurts. Number 3, shift your attention to the child who was bitten. So we don't want to offer negative attention to the child who is biting. Remember that cause and effect we talked about? If the child gets the attention they were craving after biting someone, then they may continue to misbehave to get attention. However, it's important to remember that it's okay to comfort a biter if need be. So, oftentimes, a child won't even realize that biting hurts, and once they realize what they've done, they might feel scared and sad that they've just hurt their friend. And it's okay to comfort the child and explain to them what happened. Number 4, finally, once the situation has been resolved, consider what influenced the bite and offer different coping strategies to try next time. So, biting is normal and not a huge cause of concern within the first 3 to 4 years of life. But if biting goes beyond this age, if it's excessive, or if it seems to be getting worse, you can always reach out to your child's doctor or contact us here at the Early On Center to help connect you with a child development specialist. In these in these instances, a professional can help you identify the reason for biting and help develop a strategy for addressing the behavior. Just remember, nothing is a quick fix. You should be patient and understanding with your child that is learning how to replace an inappropriate behavior with an adaptive behavior. To find out more about children biting, leave a comment below with your questions and I will address them in future weeks. Bye for now.